Finally, tell the patient you're going to check his gag reflex, which assesses the glossopharyngeal and vagus nerves. Then lightly touch the back of his tongue with the tongue blade. The patient should gag.
Now I want to take a look at your neck, so if you could just take down
To assess the neck, begin with inspection. The neck should hold the head erect and midline, should have symmetrical muscles, and should display no swelling or masses. If you see swelling below the angle of the jaw, palpate it to assess for a parotid gland problem.
Sit up straight and keep your shoulders straight.
Now assess the neck's range of motion by having the patient touch his chin to his chest,
and turn your head to the right,
turn his head to the right,
and turn your head to the left,
and left,
touch your ear,
tip his head toward his right shoulder, and toward his left shoulder,
and tilt your head backward.
And tilt his head backward. All of these movements should be smooth and painless.
Hands on your shoulders.
Next, assess the accessory nerve by providing resistance as the patient shrugs his shoulders.
Okay, and again.
His shoulder muscles should be symmetrical and able to overcome resistance.
Turn your head to the left.
Now have the patient turn his head. Apply resistance and ask him to turn his head back to the center. His movements should be equal, and he should be strong enough to overcome resistance.
And try to turn it back.
Next, palpate the lymph nodes using a circular motion. Follow this sequence, palpating the preauricular, posterior auricular, occipital, submental, submandibular, tonsillar, superficial cervical, deep cervical chain, posterior cervical, and supraclavicular nodes. Normally, lymph nodes are small, movable, soft, and non-tender. If you detect swelling or tenderness, search for a possible cause. Then have the patient get into a semi-Fowler's position and turn his head away slightly.
Turn your head to the left.
After adjusting the light, carefully inspect the internal jugular veins. Their pulsations should undulate softly and may decrease with inspiration. Now, with the patient sitting up, identify the trachea by locating the patient's sternal notch and sliding your fingers to each side. The trachea should be midline and symmetrical. Using the fingers of your left hand, push the thyroid gland to the right. Curve the fingers of your right hand between the trachea and the sternocleidomastoid muscle and have the patient swallow.
And swallow again.
Normally, you'll feel the thyroid move up and down as the patient swallows.
Okay, if you can just hold
If the thyroid feels enlarged, auscultate it for bruits with the bell of your stethoscope. Next, observe the carotid arteries for visible pulsations. Gently palpate the carotid arteries using your index and middle fingers. Remember to palpate only one carotid artery at a time so you don't block the blood flow to the brain. As you palpate, note the quality and character of the blood flow. Pulsations should be regular and strong, but not bounding. Next, have the patient take a deep breath and hold it while you listen to the carotid artery with the bell of your stethoscope. You should not hear any bruits.
I'm going to examine your chest
now assess the thorax.
Breathe normally.
As the patient breathes normally, observe